Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. Mountain pose and variations. We're going to be practicing mountain and all of its variations in this video. Let's begin. From standing, know that you can place the feet wherever it is comfortable for your hip, pelvis, spine, and knees. Some will be able to keep the feet together, while others will need a different stance, with the feet further apart. Take your time here. Get to know the earth with your feet. Imagine the feet as having four corners or foundations, and trying to press those corners into the earth. Lifting the toes so you're not gripping with them. Lifting through the arches so they're not collapsing and you feel like you're bearing equal weight through the inner and outer edges of the feet. Notice as I change positions that I'm offering different foot positions. Your therapist will work with you to decide what is best for your therapy, which is determined through a hip and knee evaluation. The feet may need to turn out. The foot may even need to turn in. Checking with spinal neutral. Maybe hiking the hip on one side and the other to balance out the weight, an equal amount of weight through one foot as compared to the other. Next, checking those bony landmarks. Do they feel well balanced? How do the muscles feel as they draw up towards the nose? Like the corkscrew sign I'm making here, it's to remind you to hug the bones of the legs with your muscles. In effect, to powerfully engage the legs, not rigidly, but to transfer that load healthily up through the spine and prepare you for larger movements, like more yoga postures or walking. Checking in with a healthy posture with a spinal neutral again. Next, we'll be raising the arms above the head. These are called arm floats. Raising the arms should not affect spinal neutral or the ability to stand tall. If it does, work with your therapist and they'll help evaluate that to determine why. Notice I'm demonstrating in a moment what happens if limitations in the shoulders may in fact affect the trunk or low back. It could create an arch in the spine or an impingement in the shoulder. You want to make sure that you have free movement of the arms that doesn't affect the trunk adversely. Your therapist will work with you to practice those arm floats, to make sure your shoulders are mobile enough to allow for functional mobility without affecting your low back. As you're practicing these arm floats, you're using a small amount of that TATD or power breath to support the trunk, to create strength, and work on endurance, which fully engages and strengthens the respiratory diaphragm. Next, I'll turn away from you so you can see how to check for something called lateral shifting in the spine. It almost feels like a little belly dance side to side. For many people, these lateral shifts exist and may affect the diaphragms, the pelvic diaphragm, the respiratory diaphragm, even into the throat. That could affect your ability to breathe, the responsiveness of the soft tissue. It could create tension, and sometimes other systems it can affect, like digestion. Now raise the arms to the sides, like angel wings. Check for the same thing. Do you feel any restriction, tension, or limitation of the shoulders, the collarbones, or other joints? And as you're able, you can begin to add a mild back bend. This is more advanced, so work with your therapist to make sure spinal extension is right for you. A final tip here would be to make sure that you're lifting the chest or the sternum skyward in order to extend the spine. Collapsing in the spine could cause shear or compression, which would work against optimal spinal health. Mountain is a foundational pose for moving forward into all the standing postures and for facilitating healthy posture and gait. Thank you for joining me.